Hello, I'm Matthew Weinstock with a look at the September issue of Hospitals and Health Networks. We're less than 1 month away from the health insurance exchanges opening for business, but there are still a lot of questions out there. Will the states and federal government be ready for the exchanges to open on time? How many consumers will actually go to the exchanges for their insurance coverage? And importantly for our readers, what will the implications be for hospitals and health systems? Here's senior writer Paul Barr with more insights.
My story is about the implications of the October 1 rollout of the health insurance exchanges as part of the Affordable Care Act. The success or failure of the act itself could hinge on the success of the exchanges. Predictions are that 7 million people will sign up for health insurance on the exchange. Ideally, a lot of those people would be healthy because they're needed to offset the cost of caring for those that are unhealthy. The success also may vary from state by state as the exchanges are different in each of the different 50 states. To get ready for the rollout, hospitals can get certified in training their staff on assisting patients and their families enroll them in health insurance through the exchanges. They can also participate in public awareness campaigns and also ensure that their clinicians understand how the exchanges work because they're one of the major conduits for spreading the information out there. Hospitals should also be on the lookout for the fact that some of the coverage on the exchanges have high deductibles, high copays, which means that the coverage may not be as strong as they expect, and it could affect them financially.
Also in the September issue is our ongoing clinical management series. In this installment, we take a look at the problem of patients flocking to the ED for dental care. As many of you know, emergency departments are ill-equipped to handle these types of cases that are often preventable in the first place. Here's Bill Santamore with a closer look.
Our clinical management story in September looks at the nation's gap in primary dental care and the impact on hospital emergency departments. It's a big problem. Millions of Americans lack access to affordable, regular dental care. Cavities are the number one chronic disease affecting children, and women between 21 and 34 are the highest users of emergency departments for dental problems. All told, there are more than 2 million visits to EDs every year for dental pain. Yet most emergency departments' staff are not qualified to treat the underlying issues of dental disease and can only give patients painkillers and try to find a more appropriate place to send them. Hospitals around the country are working with others in their communities to increase access. Swedish Medical Center, for example, teamed up with federally qualified health centers and others to outfit and staff dental procedure rooms in its community clinic. Children's Hospital Colorado set up a dental clinic that averages 33,000 visits a year. 85% of those patients are on Medicaid. And Bay State Health helped a nonprofit group launch a program to provide on-site dental care at early childhood education centers and elementary schools.
This month, we dig into 2 other hot topics that are facing hospital executives. First is the March of the Millennials. Our Generations in the Workforce series takes a look at the staffing changes that will happen by the year 2025 and what hospital leaders need to start doing now to prepare for those changes. At the other end of the spectrum, we have a feature that looks at innovations that are happening to improve palliative and end-of-life care. For those stories and much more, be sure to check out the September issue of H&HN. I'm Matthew Weinstock. Thanks for tuning in.